So if you've recently done a functional stool microbiome test and your results show high levels of firmicutes, you might be wondering what exactly does that mean and why does it even matter, right? And here's why this matters. Your gut microbiome is made up of thousands of different bacteria, but most of them belong to just a few main groups called phyla. Now, one of the most important and largest groups is called Firmicutes. Now, Firmicutes is not really a single bacteria, but it's a broad category that includes many different types of bacterial species. Some of the most well-known families in this group include things like Lactobacillus, Clostridium, Streptococcus, Bacillus species, Ruminococcus. Again, those are just to name a few. Now, some of these bacteria are obviously very beneficial. They help produce things like short-chain fatty acids, which assist in digestion and support immune function. But like any ecosystem, balance is the key. When firmicute species are overgrown, this often signals a much deeper imbalance in the gut, known as dysbiosis. So let's dive into what actually this all means when firmicute levels are elevated on a stool test. Okay, so first it's important to understand that there's a ratio of firmicutes to another group, which I did another video on, called bacteroids. But this ratio between firmicutes and bacteroids is heavily studied in gut health research. Many studies have actually found that a high firmicute levels to bacteroids ratio is associated with insulin resistance, diabetes, inflammation, metabolic disorders. So again, it doesn't mean that your firmicutes are necessarily bad, but when they dominate in the gut environment, they can contribute to many metabolic disorders and dysfunctions of various types. So what kinds of symptoms or problems can firmicute or overgrowth really cause? Well, here are some of the most important, or at least commonly reported, issues that we're seeing in the literature. Number one is weight gain, especially around the abdomen, increased appetite, sugar cravings, difficulty feeling full, gas and bloating, constipation, low energy, fatigue, especially after meals, brain fog or poor focus and concentration, and in some cases, skin issues like acne and psoriasis. Firmicute species are also known to be efficient energy extractors, and that means that they help your body harvest more calories from the food that you eat. In the short term, that might sound helpful, but over time, it can lead to weight gain, even when your diet hasn't changed. Certain firmicutes, like species like Clostridia, for example, these produce toxins that can irritate the gut lining. This can contribute to a leaky gut and chronic low-grade inflammation. And it can also influence your mood and your mental health, which is another important major factor. Firmicutes overgrowth can sometimes occur when there's been antibiotic use. So while antibiotics are designed to kill harmful bacteria, they also reduce beneficial species, especially those in the bacteroid phylum. This gives firmicutes, which are again even usually more resilient, a chance to overgrow and overshadow. This imbalance may not cause symptoms right away, but over time, it can show up as digestive discomfort, changes in metabolism, changes in immune function, and dysregulation. On a functional stool test, elevated firmicutes also suggest that your microbial diversity is low. In other words, there may not be enough variety in your gut bacteria. And we know that the lack of diversity, this is a red flag, because the more diverse your gut microbiome is, the more resilient, the more stable it's going to be. Firmicutes overgrowth can also crowd out other beneficial bacteria, which can impact your body's ability to make nutrients like B vitamins, short-chain fatty acids, neurotransmitters like serotonin and dopamine. So if you're dealing with low mood, anxiety, sleep disturbances, your gut microbiome may be playing a major role. It's also worth noting that high firmicutes doesn't tell the whole story by itself. The context matters. The symptoms that you're experiencing, your medical history, your diet, your stress level, your lifestyle factors, all of these things really need to be considered alongside the lab findings to understand what's really going on in your gut. And that's exactly why it's so important to work with a certified functional medicine provider. They can interpret your stool test results in the context of this big picture, your health picture, and uncover what's really the driving factor behind this overgrowth, whether it's diet or low stomach acid or toxic exposure, or it's just something else. Again, it's not a one-size-fits-all situation. It's all about getting to the root cause of your symptoms and creating a personalized path forward. So if your test shows elevated firmicutes, don't ignore it, but don't panic either. It's a clue, it's a message, it's a sign from your gut that something is out of balance. And with the right guidance, you can take meaningful steps towards restoring microbial balance and feeling like yourself again. I want to thank you for watching today's video. If any of this resonates with you, be sure to follow up with a qualified functional medicine doctor who can help you interpret your results and guide you to the next steps of what's involved in getting your health back into good shape. Your gut is so much more than just digestion. It's your foundation of your mood, your immunity, your metabolism, and ultimately your long-term health. Take care of it and it will take care of you. Make sure you check out some of the other videos. I'm Dr. Hagmeyer. I'll see you in this video right here.